I'm a registered nurse in the emergency department here at UCLA. I've been a nurse for over 31 years in the same department. Before we begin our press conference, we'd like to remind everyone that we are honoring the social distancing guidelines and ask that everyone please stand 6 feet apart. As union nurses, we gather tonight to commend the amazing fight and tenacity that many UCLA nurses have shown over the last few weeks, demanding and holding UCLA accountable to provide personal protective equipment, training, and other safety measures to protect all healthcare workers who are on the front lines in this fight. In the last few days, we have seen great movement of the university to address the union demands, and we are so appreciative. To explain more about our union wins that put patients first, I would like to introduce Estela Villegas, UCLA RN in the Pediatric Intensive Care Unit.
Hi, my name is Estela Villegas. I work here in the Pediatric ICU. And over the last few months, the union nurses at UCLA have fought for protections for nurses caring for COVID-19 patients. We have held multiple actions, 3 press conferences, and all of our union reps have participated in countless meetings with management in order to advocate for the health and safety of UCLA nurses. We are proud to announce that we have won significant movement from UCLA that will help nurses' safety and confidently continue to care for the COVID-19 patients during this pandemic. Last week, nurse leaders from California Nurses Association led a meeting with management where we pushed for broader access to protective equipment for all nurses at UCLA. The next day, UCLA announced a new guidance on the permissive use of face masks, broadening the number of nurses who have access to face masks. The same day, UCLA also announced new screening protocols for all staff, patients, and visitors entering the medical center and the clinics. While important steps have been taken toward improving access to protective equipment and providing nurses with the necessary training and support at this time, we still have further to go in order to ensure that nurses remain safe. Our top priority is to protect the health and safety of healthcare workers so that we can continue to provide the high quality care for our patients and our community during this COVID-19 crisis. I am proud to see the movement of UCLA forward sharing this priority.
Thank you, Estela. Now I'd like to introduce David Yamada from the Cardiac Observation Unit, who will be addressing our call to the federal government.
Good evening, everyone. I'm here today to speak on behalf of all frontline healthcare workers. And I believe that it is in the best interest of both public health and public safety. Our federal government has yet to show strong leadership in crisis management that the American public so desperately need right now to get through this coronavirus pandemic. And our federal government needs to be doing everything within their power to make sure that our healthcare system is supplied with the proper PPE and ventilators so that we may meet this impending COVID-19 surge. So far, it's the governors on the state level that's holding down the fort and keeping us in the fight. Through their decisive actions such as locking down communities, scrambling to secure PPE and ventilators, and also opening up new locations where we may care for patients, they have kept us in this fight. The states, however, are put in a position where they have to compete for the same life-saving resources. And this is not right because we're all in this together. Just the other day, California received a shipment of 170 broken ventilators. Broken ventilators from the federal government that was sent from the national stockpile. This is unacceptable, especially in a day when Elon Musk can pledge to produce hundreds of ventilators to donate to New York City and also repurpose his Tesla factory to make ventilators. We are in a war with an invisible enemy. And this enemy has already done more damage to the American economy and American society than any other foreign power has in the past. So we need strong wartime crisis management to get through this. And hence, we demand that the federal government take a more active leadership role in ensuring that our healthcare system has the resources to meet this COVID crisis. And if you look around and see all these outbreaks in the nursing homes lately of COVID-19, you'll realize why I'm standing here talking to you. Protecting healthcare workers should be priority number one, because we are all in the position to potentially transmit COVID-19 to the most vulnerable people in our society. And by protecting your frontline healthcare workers, you are not only protecting your patients, but this ultimately means protecting the community and society as a whole. Thank you very much.
Thank you, David. While nurses have been demanding PPE locally and pushing the federal government to provide essential supplies to all hospitals, today we learned that California Governor Newsom is relaxing patient care ratios for the nurses in California. We find this disgraceful. Relaxing patient care ratios through June 30th will not only burn out more nurses and compromise patient care. To address the issues tonight is Akila Tillman from the Neonatal Intensive Care Unit.
While nurses at UCLA have won significant gains that protect the safety and health of nurses and patients, we are sad to see healthcare workers throughout the country who do not have these same protections. We are here tonight to stand in solidarity with the healthcare workers everywhere and show that we are in the struggle together. You are not alone. We will continue to stand with you and fight for the protections that we all deserve. Additionally, we are here to demand full employment of the healthcare workers here at UCLA. This morning, Governor Newsom announced a temporary executive order that could allow hospitals to shift staffing ratios and licensing requirements through the end of June in order to respond to this expected influx of COVID-19 patients. As nurses, we fully understand the need to be prepared in the event that this large influx of incoming COVID patients. There's no reason any nurse should be getting laid off or having his or her hours cut during this crisis. Any nurse that is ready, willing, and able to work should have the opportunity to do so. This includes the nurses and nurse practitioners from the student health centers, outpatient clinic settings, and every other unit in the medical center. We are calling on UCLA to continue to show leadership and maintain ratios throughout this crisis. We demand full employment at UCLA. We understand this crisis will require all hands on deck in order to fight it, but we believe that this is possible to do so without risking the quality of care and that these nurses provide.
Thank you, Akila, and thank you everyone for being here tonight. I want to end as union nurses at UCLA by saying we want to let all healthcare workers in this country and around the globe to know that we are in this together and that we stand by you. Patients, our community should know that we are here ready to care for you. We ask that the general public continue to please stay safe at home so that we could do our job and contain the exposure. Again, we thank you for coming out, and please stay healthy and safe. Together we will defeat this virus, and together we will be stronger. Thank you.
Can we ask you a question?
Sure.
I'm so sorry. I was confused. I thought today Governor Newsom, I'm so sorry. I thought Governor Newsom basically was asking retired nurses to come forward, that he's so desperate for more personnel. But that Akila was saying the opposite. When was that announced?
Listen, I'm so sorry. I was unable to watch the news today, so I heard bits and pieces about retired nurses being called back to work, retired doctors, retired. New York's doing the same thing. But I also heard through several of my text messages coming through that he has asked that we consider relaxing the ratio law, which will make this even far more dangerous. We have ratio laws. We're the only state in this country that have ratio laws, and if you look at our statistics, we have saved lives because of these ratio laws. Right now we're dealing with a pandemic that requires, if you're in our medical ICU right now, these nurses are working so hard to save, I'm sorry, I'm gonna get teary, to save lives. If we relax the ratio laws, we're gonna lose far more people, so please, we cannot relax the ratio laws. We are very fortunate in our state to have these laws, and we must continue on. Well, it's kind of complicated. It's based on the severity of the acuity of the patient, how sick they are, and the department that you work in. It depends on again the acuity and the level of severity as to how many nurses per or how many patients per nurse is a safe number. So, for example, I work in the emergency department. If we get a critical trauma patient, until that patient stabilizes, it's at least a 1-to-1 ratio, if not a 2-nurse-to-1 patient ratio. Sometimes it's 3 nurses. That's how sick people get. So in the ICU, they're definitely either a 1-to-1 or a 1-to-2. Again, it depends. Pardon me? Oh, because our country had time to get ready for this. We knew it was going to be bad. We are the richest, supposed to have the best. We spend more money on health care, and it's all failing. We are seeing our colleagues die. We are seeing our community die. Our grandparents, our parents, our brothers, our sisters, our cousins, our neighbors. Just wasn't handled right. And you know, money isn't everything. Our economy will bounce back. We will bounce it back. And yes, this is a hardship for so many, but listen, your life or your paycheck. Our government can reach out and give these people who don't have a job more money. $1,200 is not enough. So we need to hold our federal government accountable for this. You're welcome.